The subject is the strangest medical conditions. I will talk about walking corpse syndrome. And who discovered walking corpse syndrome? Carter syndrome was originally described in 1888 by the French um, psychiatrist Jules Carter, and who called in the Tailored test negotiations. The characteristic symptoms of the syndrome is nihilistic de- delusions. Typical patients believe they have lost organs, blood or body parts, or even that they are dead. This relatively rare syndrome exists in patients with de- depressions and schizophrenia and psychotic disorder caused by general medical conditions, and it is often associated with dementia. Um, what is walking corpse syndrome? Um, People with Carter syndrome, also called walking corpse syndrome and Carter's delusions, believe that parts of their body are missing, or that are they are things that or don't exist, and they many think nothing exists. Carter's syndrome is rare, with about 200 known cases worldwide, and now the symptoms are extreme. Most people quite better with treatment. Symptoms. Um, and people with this syndrome often become much less social. Sometimes anti-money stop speaking and hold. Some hear voices they hold tempter that are dying. Um, Others money refuse to hit because, among other reasons, they see no point since their death, and some money try to harm uh, themselves. And causes. It's not clear what causes Carter syndrome. We do know that it's often a symptom of deeper medical problem that affects the brain, such as dementia, encephalopathy, en- encephal- encephalopathy, a disease where a various and toxin affects how your brain works, um, epilepsy, um, migraine, multiple sclerosis, um, Parkinson's disease, and stroke. Um, who gets it? Carter's syndrome can happen at almost any age, and though it strikes many people in their early 50s, many people who who have it also have a history of mental health problems, especially especially um, the depressions and anxiety and schizophrenia and substance abuse. Most have some kit of brain damage that shows up on imaging tests. The harmony comes from a strong a tumor, a blood clot, and injury. injury. Additionally, carpal syndrome among house bipolar disorder in teens and young adults. Treatment. Doctors have many uh, ways to treat carpal syndrome. The usual approach is to treat the medical problem that's causing it. Most people to pass with a combinations of medications and for until um, therapy like cognitive, um, behavioral therapy or psychotherapy, and bandits provide on-site plus for people and to talk about how to feel and help them hit and hand flare once the thing on earth. Um, Medicines used to treat Carter syndrome include um, antiso- antipsy- antipsychotic, anti-anxiety drugs, and antidepressants. And thank you.